So with conservative care, the mainstay of conservative care is actually compression. Compression, compression, compression. Compression is one of those things where it's not the right choice for everyone, but when it works, boy, is it a good one. Compression will stop the progression of venous disease, and it will control the symptoms commonly associated with disease. So in a way, it's perfect. Plus, the risk of while wearing compression is virtually nil. The most important thing with compression is that it fits well. And here's one of those things where the sizing of compression garments is truly unique in that instead of going small, medium, large, or regular pant sizes, we take circumferential measurements of patients' legs at different levels. And once we have all these levels, we plot them on a graph and we say, okay, this is the size stocking that you're going to need. Now that doesn't take into account if that patient is 4 feet tall or 6 feet tall. So clearly there's some holes in the sizing theory. So what I tell my patients for the conservative management, for compression, for buying their first pair of stockings is when you buy them, make sure you know the return policy. Buy them, try them. If you don't like them, return them and try again. Some of these stockings, some brands will run long, some brands will run short, some will be high-waisted, some will be low-waisted. There's 101 different cuts out there. And there's a different one that's going to be right for every single person out there. I have some patients who will say, oh, I could never wear compression stockings. I have GI issues. I can't stand any pressure over my belly. I always tell them, well, there's 2 different maternity cuts. One is kind of a high rise that goes, it's designed to go over the baby bump. And the other is a low rise that's designed to sort of hug your hips and go lower than the baby bump. The nice thing about the low rise ones are they have a very nice, soft, gentle elastic band that don't roll. So they're a nice option. I have some folks who say, I could never wear compression stockings all the way up high. I have to go to the bathroom too much. Well, they make chap style where you don't even have to pull them down to go to the bathroom. There's other people who say, I can't find any, they're all too long. And I encourage them to look for brands that make a petite cut. There's some people who say, geez, no matter what I do, they bunch up behind my knees or in front of my ankles. And, all of these fitting issues, they're all exactly that, issues that can be worked out. So finding a good fitter in your community who can work with patients if they're going to manage conservatively is imperative. Getting patients in a pair of stockings that feel good. They fit when they feel good. Imperative. Best way is to have them try on a whole bunch of different brands and be able to return them if they don't like them. So although it's hard, I think patience and persistence can get people into a comfortable pair of stockings that can really be a game changer. Along with compression, when we talk about conservative management, we talk about elevation, and elevation can mean a lot of different things for a lot of different people. Generally speaking, the rule of thumb is 3 minutes of elevation with your feet higher than your heart 4 times throughout the day is enough to control the average person's symptoms. This isn't perfect, but it really does make a big difference. And then lastly, exercise. We oftentimes in the world of veins talk about your calf muscle being the heart of the venous system, meaning as the blood leaves your arterial side of the equation, passing through the little capillaries, the pressure is virtually nil. So we need pressure to get that blood up against gravity to our hearts. And the way we do that is with calf muscle contraction and relaxation. So for some people, conservative management can consist of calf muscle pumping. Walking is a great way to get those calf muscle pumps, or just tapping your toes, tapping your heels, and anything that moves that foot up and down is going to squeeze and relax that calf muscle. So all 3, exercise, elevation, and compression, can be game changers for some people in terms of controlling their symptoms of venous disease. Again, most people in their younger years really aren't that interested in making the kind of commitment it takes to donning and doffing compression on a daily basis. But as people hit different points in their life, sometimes compression is or conservative management, I should say, is a perfect match for end game goals. And this is where it goes back to asking patients and listening about what they want out of their vein health and any treatment options that we can offer.